Senator Wilson.
Well, the good thing about going last, and I agree with Senator Steiner, is that a lot of things were already commented upon and already broached upon. So I'm going to take a little bit different approach. I've been in the state senate for it's my first term, 2 years, and I've been chair of the Health and Social Services Department within our state senate. We have a small state in sort of population, but it's the largest state in terms of vastness and square mileage, which adds a little bit more difficulty to trying to find streamlined methodologies because we're dealing with 230 plus tribal entities, which are separate, and tribal politics is a little bit different than rural politics, which is different than urban politics. And with that, I will say that all politics comes back to being localized, no matter how we approach this. So part of what I've been focusing upon is trying to have sort of an inter-departmental between Department of Ed and Department of HES, Health and Social Services, a little bit more of integration between that because a lot of our state funding, that's the bulk and majority of that. It's about $2 billion in our state goes to HES and goes to education, and a lot of the pre-K, prenatal is within Department of Health and Social Services, which does not really integrate well with the Department of Education, how that funding sort of utilized and through the K-12 development and even through pre-K. Our state is sort of lacking within the pre-K. We don't really apply. This is the first year that we've been sort of pushing for the Department of Ed to apply for some of the federal funding and some of the new grants that just came out through the federal administration to help fund pre-K. So the best way, sort of the advancement of the development is what sort of what Dr. Duncan and Mr. Cagle said is funding. We have a budget deficit, and now the best analogy is that we are a sinking ship, let's say like the Titanic, and we need to plug that hole. And we have a grand piano, but put the piano in the hole. But we have a piano lobbyist that comes out and says, no, let's not. Let's save the piano. We need to save this for the music. All right. Well, what about the deck chairs? You get the deck chairs lobbyists to come out. Well, wait a minute, Senator. We need to protect this for this. And so it is so hard to say what are you going to supplement and to fund. We all know sort of we'll use the Kaiser Permanente ACEs study. We all know what type of risk factors happens the more ACEs you have and what sort of correlations and causations that could lead to in the future. But even Kaiser Permanente, who sort of led the way on the study, they don't really look at focusing and fixing that. You ask them over the years what they focus on, it's smoking cessation. Why? Because it's easier and measurable to show outcomes in that than it is to show that later down the road. So as you're researching, as you're developing, try to come up with very short-term outcomes that we can use to help sell this to our other colleagues. It's very hard to say, well, in 20 years, we're going to see the effect when our terms are 2 to 4 years. And so I hate to say that, but a lot of folks are just focused on getting elected. You won't find, my colleagues up here, they're dedicated into working on this, and you won't find that dedication across for us, 60 legislators. I can tell you in the Senate and the majority, we probably have about three that are really dedicated in that. Four out of 20 senators are probably, this is their focus and do that. We had to sell the other 17 folks, 16 folks, just in our body, not let alone trying to sell the administration. And then you have to sell, the general public. And so hearing and having evidence-based models and best practices is very important because it helps us to give a timeline and it gives us sort of what type of results and objectives are achievable and sort of what the cost may be. So having things that have worked before, we always beg, borrow, and steal from other states, and that's why I love working with my other colleagues because we can have this discussion across state lines. Because Alaska, we always think, oh, we're so special, but our issues and problems aren't that special compared to what the rest of the nation is focusing on, and trying to move away from that isolation is also very important for our state. One of the things that I've learned most is that you have to sell with emotion, but you buy with logic. And so you have to have that emotional sell and draw to say, wow, this is important. This is why I should care. Because again, it's all about localized. We always start with the story of ourselves, we move on to the story of others, and then we move on to the story of now, why this is important to us now. And if you can't develop that story within the research and have this is why we need to, this is important and why we need to engage, we're not going to be effective in leading and driving policy change and selling this to our constituents and selling this. Like I said, everything comes back locally. We have a wonderful health foundation, and with the funders, they have a group. It's called Raising Our Kids with Kindness. It's part of our Matsu Health Foundation, Rock Matsu, and they developed a way to start a trauma-informed schools and centers, and trying to improve on graduation rates within the high schools. They worked on fit courts, sort of the families and tradition kids courts, to give every resource necessary possible, and they're showing tremendous results. And what they're doing is they're taking us to community and building sort of a statewide coalition. And thus, when I'm talking to the legislator and let's say Homer in bottom part or Kodiak, Alaska, they already know the same success stories that they're having. Thus, I can talk to another legislator in Juneau or Nome, and we can start building that. And they're seeing the local results through their local communities, and we're all on the same page of talking and trying to promote the same sort of social issues with pre-K and child wellness. It's, the way that I see sort of the movement of a policy is that we look at four things. You know, is what we're doing, is it good? And is it good? Are we making it better? Is it good? Are we making it to the best? Or the same thing, if it's bad, are we making it better? Or if it's bad, will this make it great in terms of what we're doing and how we introduce policy? So we have sort of the ideas phase, and this is where we're at now with sort of universities, institutes, research theology. That goes through the policy phase, which you have people, sort of the think tanks, the public interest, sort of the journalism, news, and we start developing model legislation. We move on to the legislative phase, where you sort of have those grassroots advocacy groups, your lobbying groups, and other advocacy-based groups coming to talk about these policies, talking about the research. Then you get to the decision-making stage, where you have us, the elected officials, trying to get the vetting and trying to go around and make sure we have the votes and selling our voters and sort of the direct advocacy groups that are going out and doing this. And then we sort of have the action. And that's where it's the hardest part, is the actual change piece. Because the two hardest things is change and the way things are. But it's easier to keep things the way things are. So when you're trying to look at policy that's going to change, make sure they're easy change, measurable change, and change that you won't, that for us, we have this group, we call them the weebies. We be here when you're gone, because again, we're, and so we need to make sure that we can get that buy-in from all those level groups. And it's so hard to get that change, because in, our wonderful political systems across the nation, it's really hard to get legislation passed, but it's really easy to kill it. And so if we don't get that buy-in, we don't get all the support, you never know what may come up to just stop that in that process. And so as we're going through those 5 steps, we make sure that we have that buy-in, we're getting the groups, we're building the success models. And that's what I found to be really successful in trying to get legislation passed and pushed through, is working with our colleagues. We sort of try to look for each other for those expertise and trying to find out who are the champions in each set, working across the aisle. It's really hard to move beyond sort of what's in this for me, what's this for my best group, what's best for the majority, minority, and move beyond that and trying to see how this will benefit us, like I said, as a local level, and how this will benefit us as a state, because all politics, again, is local. And with that, I'll end for questions.